cover leukemia with Dr. Ramesh, who's here today as well, to take part in the session. So definitely, we're going to be covering as much as we can. Let me quickly run you through the next scenario so that we can actually practice it. And I'm going to obviously be in there doing my best for good old Mr. TB. What do we know about Mr. TB? There's another one that's important as well, which is PCP. We'll talk about that later. It's really, really tough. But your Mr. TB here is going to have had a cough for 5 weeks. Again, all the usual DDs in there: cancer, TB, lymphoma with night sweats, all those stuff. But the contact tracing and travel history will also be there. And we don't really skip those in any of these scenarios anyway. So you'll find them as you do your approach properly. So I don't want to waste too much time talking. I think it's time to act. And who will be my patient? I think Dr. Ramesh, you can make your introduction as my patient. How does that sound?
Yes, that's okay.
That's great. Thank you very much. Don't go easy on me.
Okay. All right.
Enter the room.
Hello.
Hello.
Hi, my name is Dr. Radwan Ali, and I'm one of the doctors here in the GP surgery. Can I just quickly confirm your full name and age, please?
Well, my name is William Smith, and I am 50 years old, doctor. 30, sorry.
Okay. 30 years old. Thank you very much. How can I help today? I understand you had a few concerns.
Doctor, yes. Actually, I'm having this cough.
Okay, you had this cough. Can you tell me more about this cough? When did it begin?
Doctor, it's been like 5 to 6 weeks.
5 to 6 weeks. Okay. I hope you don't mind my asking, is there any particular reason why you came now since you had the cough for 5 to 6 weeks? Has anything changed?
Well, yes, doctor. Since the last 2 days, I'm feeling that there is a bit of blood in the cough. So
Okay.
that's why I'm worried.
Okay, so there's blood in the cough now, is it?
Yes.
And in the last couple of days, you said? Two days?
Yes, it's 2 days.
Okay. Can you tell me a bit more about the cough itself in terms of the sputum? You mentioned it's got blood. How much sputum comes out?
Let's say it's like a half of a cup.
Half of a cup of sputum. And is it tinged with blood or is it just full of blood?
Oh, no, just a little bit of blood, but it's like from 2 days. And other than that, it was just the sputum.
Okay. And are you coughing very frequently or is it on and off?
Oh, yes, it's been very bad. Like I'm coughing all day, and my wife, she's also very disturbed, and she's basically my girlfriend, so she's
Okay.
very.
Okay, thank you for giving me that information. It really helps. Just a few more things about the cough. You mentioned that it started, 6 weeks ago, 5 weeks ago. Was it sudden or was it gradual when it first began?
It was sudden, and then it stopped like 1 or 2 days, and then it started gradually, and now it has increased a lot. I'm coughing all day now.
And does anything at all help with the coughing, such as movement or anything like that?
Oh no, nothing like that.
Does anything make it worse at all?
No, maybe when I walk more and do some like exertion or some work.
Okay, it really helps. Thank you for the information. I've got a few more yes/no questions to try and identify what could be the cause here. Some may sound irrelevant. Please do bear with me. I have to cover a lot of bases. Have you been running a temperature at all?
Yes, I've been running some temperature.
Do you get any night sweats?
Oh, yes, night sweats as well.
Okay, I see. And do you have any lumps or bumps anywhere in your body at the moment? May continue, please. Any lumps or bumps in your body? Hello?
Yeah, hello? Yes.
Any lumps or bumps?
No.
Okay. No lumps or bumps. Okay. Any shortness of breath at the moment?
Not at the moment.
Okay. And generally, do you have any shortness of breath?
Yes, sometimes when I'm working.
Okay. Any chest pain?
No.
No chest pain. Okay. And just to quickly ask you a few questions in terms of your tiredness levels. Are they okay or are you feeling tired? You mentioned that you get shortness of breath when you're walking.
Doctor, I feel a bit tired as well. I don't know why, although I'm 30 and still I feel tired at this age.
Of course. Do you get any lightheadedness or dizziness?
Not so much. Sometimes.
Okay. Do you feel as though you're about to faint?
No.
Okay. Do you have any pain in your calves?
No.
Okay. Can I ask a bit about your appetite? How's your appetite been?
My appetite, it's fine. Sometimes I eat less as I'm at work in the day.
Okay. And are you losing weight?
Oh yes, doctor, I've been losing so much weight,
Okay.
like
Okay.
6 to 7 kgs during the last month, and
Okay.
this is surprising.
Okay. Are your bowel habits okay?
Yes, they are fine.
Okay. Thank you for answering my questions. I just want to know a bit more about your background health. Do you have any medical conditions at all?
No,
Are you on any medication?
no medication.
And do you have any known allergies to any medication or food?
No, with peanuts sometimes.
Okay. You mentioned that you live with your wife. Has your wife, or your girlfriend, sorry, has she developed any similar symptoms at all?
No, she's fine.
Okay. And has anyone in your family had any similar problems in the past?
No.
Okay. May I ask what you do for a living?
Well, I work as a barber.
Okay. And in the last 6 months, have you traveled abroad recently?
Yes, I went to Philippines for 1 month, and
Okay.
for 3 or 4 months ago.
Okay. Okay. I hope you had fun over there. Just a few more questions. You mentioned you live with your girlfriend. Just want to know if you smoke
Yes.
and do you drink. Oh, how much do you smoke?
I just take 5 to 6 cigarettes a day.
Okay. How long?
It's been 10 to 15 years.
Okay. And do you drink alcohol?
Yes, sometimes, occasionally.
Okay. Thank you very much for answering my questions. It's important I examine you. I'd like to check your observations, your blood pressure, your heart rate, how fast you're breathing, and your temperature. I'd also like to listen to your heart and listen to your lungs as well to find any problems there and look for any lumps anywhere in your body as well. Okay. So
Okay.
thank you so much for answering my questions. You mentioned that you had a cough for 5 weeks and now it's got a bit of blood in it. You also mentioned that you're sweating at night and that you're getting short of breath, when you exert yourself and you're tired. I suspect that the likely cause of your symptoms could be an infectious disease known as tuberculosis, which is caused by a bacteria, and it can really give you the symptoms you're feeling right now. Is that clear so far?
Doctor, what kind of disease is it? Is it
Um,
infectious?
Yes, it's caused by a bacteria. It's quite infectious, and it's important that you're treated with certain antibiotics, and it takes about 6 months to treat that. But before that, I do have to inform the local health protection unit as well, because it's a communicable disease. It's easily transmitted through air droplets, and it can spread to other people and cause very serious infections if it's not treated.
Oh, what about my girlfriend? Is she having it as well because she's living with me?
There's a chance that it could have been transmitted to your girlfriend because it is about close proximity. So we would advise that she also get tested. The local health protection team would do what's called contact tracing, and they will inform them to come and get tested and also get treated as well. Usually, we do need to take sputum samples in the morning, and we would like to do some x-rays and blood tests to make sure we see how it's affected you, and you may need treatment for 6 months, like I said. Is that clear so far?
All right, doctor, but am I going to get fine after 6 months of treatment?
Yeah, usually it should work. You'll be taking the antibiotics. It's called the full
Move on to the next station.
I've got no time left.
You.
So,
Thank
okay, thank you. Feedback time.
Okay, so it was a good consultation. Like you covered everything.
Thank
It was
you.
perfect.
Very blunt. I appreciate that. Okay. Mariam is here as well. May is here as well. Have we got things to add?
Yeah, I think basically the consultation went way long towards the history point because the patient was responding in long sentences, and normally that doesn't happen in the exam because they're
Happens
kind of
quickly, you
straightforward.
mean?
Yeah, yes,
It's
no, yes,
potentially
no
true,
kind.
yeah.
Yeah, and then you don't have time to think of the question in the exam. That happens. But
Yeah.
yeah, so that's basically why I think the history part took really long time. But having said that, that was okay. Yeah, and then obviously when you've got 2 minutes left, you tend to get a bit quicker towards the end because you need to touch
You gotta
every
make
single
sure
thing.
that you show them what you know. Yeah.
Yeah,
So yeah,
and not really. Yeah,
I think
yeah,
Ramesh did a fantastic depiction of the patient. So great
yeah,
simulation there with all of the
yeah,
points noted. Yeah.
yeah. Yeah, so everything is okay, yeah. And then it depends if the oxygen stats were low or do you want to admit the patient or
And
not.
if there is high
Yeah,
fever as well, systemically
yeah. So
unwell
you
versus
need to,
unsystemically unwell, and I'll talk about that in a second. Yes.
yeah,
Okay.
that's it. Yeah,
Yeah,
thank you.
that's good. Okay, so May, any other takeaways from that before we move on?
No, nothing. I
Okay.
really like the way you talk about the sputum sample in the morning. It's really good one because normally I would just say about induced sputum.
Okay,
This is
okay.
a really good one. Thank you.
I appreciate that. So yeah, let's talk about quickly what you can find. The observations could show a low-grade fever when you do your observations. The chest x-ray itself can show consolidations, cavitations, and lesions. So you do need to send for these investigations, including full blood count for anemia and obviously infection markers. Also, a respiratory examination, they can give you findings with crackles or bronchial breathing, dullness to percussion, and lymph node enlargement. So in your history, you may want to quickly ask about any other problems because sometimes extrapulmonary TB signs could be there. But I don't believe you fail too hard if that doesn't happen, guys. You're just going to ask about the symptoms generally. Have you got any numbness or tingling sensations? How are your tummy? You're doing a cardiovascular examination and you're going to ask about joint pains because it can affect the bones as well. But because the patient was young, we expect it to be, the TB, we expected its shortness of breath. The presenting complaint was in the right place. And further, tests and further management will cover to look for extrapulmonary TB signs. So don't worry too much about extrapulmonary TB signs. I'm just mentioning it. Now, for your ECG, it's important to do because TB pericarditis exists as well. So don't forget an ECG. I think I forgot the ECG. I didn't get, the chance to do the ECG. The urine dipstick, also very important. I don't think I did it. I don't think you lose too many marks if you didn't do it because you recognized pulmonary TB and you actually sent to the right place, and they will usually make sure they do those things. So I don't want you to worry too much about missing some of these extensive kinds of examinations and investigations. But good news is it's easy to remember bedside tests. ECG is easy to remember, urine dipstick is easy to remember, and your respiratory and cardiovascular examination will give you the findings if they're there. So don't worry too much at all. Management. For your management, I need you to know that you have to do routine bloods, you have to do sputum culture, and you have to do an X-ray. I also need you to know in management that you have to refer the patient to the TB team. What will they do? They will confirm, they will treat, and they will contact trace. Ask yourself, did you do contact tracing history? If highly symptomatic or or unwell or homeless, we may need to arrange an admission. But if somebody isn't homeless, isn't highly symptomatic, and isn't unstable, then what we instead do is that we advise how it's transmitted, that you can pass it to close contacts, and how they can prevent transmission by closing the mouth, okay, and by disposing of tissues, and by ventilating the room. And they can get a sick note for 4 months for TB. The treatment will be for 6 months. You don't need to tell them the antibiotics, guys. It's right. Rifampicin, isoniazid, pyrazinamide, ethambutol for 2 months, and then the first 2 for 4 months. So 4 for 2, 2 for 4. Give them a leaflet. Just say 6 months duration, guys. Just tell them about the leaflets and explain it's important to adhere to the treatment. Again, this is towards the end, and we offer any psychological support, any lifestyle advice that we need for any of those kinds of scenarios. So the main takeaway is do the tests, refer to the TB team. They will confirm, treat you with antibiotics, and contact trace. And any close relatives and close contacts may also need to start treatment if they're confirmed. Other than that, I need you to know that it is transmitted by air droplets. So you can prevent transmission by covering your mouth when you cough, also by disposing of tissues, and to ventilate the room, and don't share, food and drink with others as well. I can give you a sick note for 4 months. You work as a barber, you're going to be in close contact with people cutting their hair. It's important that you know that you can pass it on to them. So this is key as well, the advice. So that's great. Let's see if there's anything. Keep going. We keep going. I think there's just a couple more to do in terms of this section here, okay, for hematology. So let me just look for the other ones, hematology. And we got the bad boy just loading up. Okay, you've got multiple myeloma, iron deficiency, B12 as well. Dr. Zishan had an emergency, which is why he couldn't make it for the second session. But tomorrow morning, he'll take you first thing through the day 2 topics. And you'll probably definitely see Dr. May, Dr. Mariam, Dr. Arish very frequently as well. And it's a pleasure to have you guys here and giving your experience, your knowledge back, and also learning. Me as well. I give and I also learn. I think I did a few simulations today and I kind of learned a few things from doing those simulations myself. The Q score, time management, I was taking too long in my initial history, and then I tried again and I did it better and I managed my time better. And that's how it works for you guys too, when you're doing your practice. Now, I think we will do multiple myeloma, and we will finish today's session just 1 hour early, only because of the emergency that came up. It means that I also have to have a look at the building, make sure that everything is okay there. And that means that I also need to go, but you don't have many leftovers for today. You only have 3 scenarios left over. So everything is going according to plan, even earlier. So that's fantastic. In terms of the scenario for multiple myeloma, I want to give you an idea again of how you recognized it, right? It's a 70-year-old lady. She came for a follow-up at the GP. She presented with 1 week ago, back pain, tiredness, had blood tests done. What did they show? Anemia, microcytic anemia. And obviously neutrophils, white cells, they're normal. So now you've got the anemia, and you're not stuck because you've got ESR that's super high. You have LFTs normal. I'll tell you right now, the UNEs are also normal. Even the creatinine in there looks normal. Urine test is negative for nitrites, negative for leukocytes, positive for protein, triple plus, Bence-Jones proteins. If you did your Plab 1, you know what that means. That is multiple myeloma. So what does your history include? Your history includes symptoms of hypercalcemia, increased urination, increased thirst, constipation, and any confusion. It also includes back pain and tiredness history that she herself came for in the last couple of weeks. So your job is to ask about the back pain, ask about the tiredness, and look for other complications that are known for multiple myeloma, and manage accordingly suspected multiple myeloma to be confirmed with a bone marrow biopsy. So we have a patient who had 3 months of tiredness. Okay. Chest infection 2 times in the last 3 months, was treated with antibiotics, has recovered now. Frequent infections are also positive. Has high blood pressure, takes amlodipine. And then you have the other task, psychosocial. Remember, this patient can no longer take care of their grandkids because for the last 2 months, they're too tired and they have too much pain, and it's preventing them from going to look after their grandkids. The daughter used to drop her kids at her place. She used to look after them. I can't do that anymore, doctor. Right, I'm so sorry to hear that. I can see that you really looked forward to having your children, your grandchildren come and visit you, and it must be difficult now not to be able to take care of them and do what you wanted to do. Good. She lives alone, and the back pain has affected her life. She cannot look after her grandkids. So you need to manage that as well. How? By being empathetic. Other than that, you will give the diagnosis and you will refer appropriately. And we're going to do this one quickly, finish off this one by showing you multiple myeloma. This time, we're going to go for NHS. You can refer people to support organizations and the like. So I want you to quickly have a look here. Let's just keep this along here. Okay, plus a little bit. Okay. So explain what multiple myeloma is. Okay. It's a type of bone cancer. Okay. It's a type of bone marrow, cancer. Okay. Bone marrow is a spongy tissue at the center of the bones, and it produces your blood cells. Okay. And it can affect different parts of the body and bones. And so in the future, if you are struggling for any definitions, you can quickly look here, but you still have the job to paraphrase what you see here as easily as possible. Okay, so it's called multiple myeloma as the cancer often affects several areas of the body. What can you say? It can affect multiple areas of your bones, such as your spine, your skull, and things like that. Even then, multiple areas of your bone is more than enough. Symptoms. This is for you to know that we had the symptom of anemia in our patients, but you can also get hypercalcemia symptoms, which are extreme thirst, pain, urination. It looks like diabetes. It walks like diabetes, but it's not diabetes. What is it? Hypercalcemia. So other than that, it can also go in other areas. Remember that it causes hyperviscosity, which can give dizziness, headaches, and things like that, and repeated infections as well as bleeding. So this is your key history taking, right? This is your key history taking. So this is to assist you in the future if you're in a position where you can't really you need to learn how to quickly search things and get the information accurately for yourself. You become independent in this way. And that not only helps you today, but helps you in your future as a doctor in the UK. So we talked a lot about red flags, when to see the GP and things like that. It gives you an idea of how they themselves advise patients, and you can try to follow this, but we won't spend too much time here. They're already in the GP. They already came to see us, and we don't need to do too much here except for explain that once it's confirmed, once it's confirmed, right, treatment is available, okay, to try, okay, and destroy the cells that are causing the problem, okay? And also, the treatment will focus on trying to treat any problems that occur from this cancer, okay, by replacing your blood levels or giving you something to increase your blood levels, okay, and prevent fractures and bone pains.